Let me quickly walk you through full mock on homeless patients. Yes, it's going to be a full assessment. We're going to write 2 care plan for this patient. Also, we'll serve medication for this patient. That's the implementation station. And we will hand over this patient in evaluation station. Without further ado, let's get into it. As I approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene according to WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left dorsum, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of my thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? Right. The reason why I'm here is to carry out a full set of observation on you following APIE approach and to ask you a few questions about your activities of daily living. Is it a convenient time, please? All right, thank you very much. Before we proceed, could you please confirm your full name and date of birth while I double check with my paperwork, please? All right, I have Janet James. Your date of birth is 01/01/1992. Your first line of address is 27 Dalton Grove, Badley Green. Right, I have it properly documented here. Are you allergic to anything at all, please? All right, it is properly documented here that you are allergic to penicillin. What reaction do you get whenever you take penicillin? Oh, rash. It is properly documented here that you usually get rash when you take penicillin. I want to assure you that nothing containing penicillin will be administered to you. Is that okay? All right. How may I address you, please? All right, Janet. Okay. So, assessor, I can confirm I am with the right patient and I'm happy to proceed. All right, Janet, I'll be stepping aside now to gather the equipment I'm going to be using to carry out the assessment on you. If you need me, do make a shout. Is that okay? All right, I will be right back. Okay, so leaving my patient bedside, I will go ahead and perform my hand hygiene according to WHO standard. Assessor, could you please confirm my equipment are clean, calibrated, and are ready for use? All right, thank you very much. All right, Janet, I'm back. Are you still happy for us to continue? All right. Can I confirm with you if you've been resting in the last 20 minutes, please? All right, and your legs are not crossed. Okay, so I'm going to be starting with a full set of observation now, then we proceed to the APIE approach later. Is that okay? Right, so I'll be starting with your blood pressure. Right, which of the 2 arms would you prefer the cuff to be tied to? All right, your left arm. Right, can I confirm with you if you've had surgery done on this arm? All right, I can confirm the arm is visibly clean. There is no signs of infection, no signs of inflammation, no skin lesion, no excoriation, and I'm happy to tie the cuff. All right, Janet, I will be tying the cuff to your arm now, about 2 to 3 centimeters away from the cubital fossa. All right, I will make sure it is not too tight and it is not too loose. You may feel a little tightness. It's going to be for the time being, right? And you'll be fine again. Is that okay? Right, so I'll go ahead now and tie the cuff now. Right, I'm sure I have the right size of cuff. I will not be turning on the machine immediately. Is it okay to use your other hand, please? All right, thank you. Okay, so I will be depressing your fingers now for 5 seconds to check for your capillary refill. Right, you can see the fingers are visibly clean. There is no false nail, no nail varnish, no skin lesion, no inflammation of any kind. I'm happy to depress your fingers for 5 seconds now. 1, 2, 3, 4, 5. It returned in less than 2 seconds, meaning you are properly perfused. Right. I'll go ahead now and put the probe. Then I will start the blood pressure apparatus immediately. Your blood pressure is 120/80 millimeter of mercury, which is still within normal therapeutic range. And your SpO2 is 96%, and you're saturating on air. That's within normal therapeutic range also. Right. I will remove the blood pressure apparatus now and keep it aside. And I will remove the pulse oximeter to clean that later. All right, Janet, I will be checking your heart rate now for the next 2 minutes. And during this time, I will not be talking to you, and I want you also to remain quiet, if that is okay with you. Right. So I'll go ahead now and palpate Janet's radial artery to check for the heart rate. So, assessor, my time starts now. Thank you very much, Janet, for your time. I'm so sorry. I actually checked your respiration for full 1 minute, and the remaining 1 minute is for your heart rate. I'm sorry I didn't get you informed earlier because I don't want the reading to be altered. All right. So I'm so sorry for that. Okay. This is an infrared thermometer, Janet. It is a device that is used to check temperature. Right. It's not going to harm you, and it will not even have direct contact to your skin. Right. Prior to checking for my patient temperature, I'm checking the forehead now. There is no excessive sweating, no swelling, no inflammation of any kind, no skin lesion, no excoriation. I'm happy to check Janet's temperature. Your temperature is 37.2, which is still within normal therapeutic range. All right. So now we proceed to A to E approach. Since the procedure began, I can see you've been talking to me normally. I don't want to assume that your airway is patent. To further establish this, Janet, could you please make a cough? Oh, fantastic. Right. Can you take a deep breathing breath also? Good. Assessor, I can confirm that Janet's airway is patent. All right. Moving on to B, which is the breathing, I'm going to be checking the rate and the depth of your respiration. The other time I checked for your respiration, it was 18 cycles per minute. I'm quite happy with it because it's still within normal range. The depth of your breathing is not shallow. You are breathing normally. Talking about respiratory noises, such as regarding visual sign of respiratory distress, there were none that were identified. You were not using accessory muscles to breathe. There was no seesaw breathing, no breathlessness, no excessive sweating. Talking about your air entry, there is equal air entry because the bilateral rising and falling of your chest was equal. So I'm happy with that. Regarding your SpO2, you're saturating on air, and the reading I got was 96%, which is still within normal therapeutic range. I'm happy with that. Moving on to circulation, the other time I depressed your finger for 5 seconds, I'm happy because it returned in less than 2 seconds, meaning you're properly perfused. All right. And as for your heart rate was normal at 72 per minute. The strength and the rhythm of your pulse was normal. I'm happy with that. Moving on to D, Janet. Do you know where you are at the moment? Hotel. That's correct. Yeah, you're actually in the hotel. You know what time of the day it is? It's actually afternoon. Fantastic. You know who I am? Yeah, I am your nurse. That's fantastic. Well done, Janet. Okay. And can I ask when last you visited the loo? Do you experience any pain while urinating? Oh, not at all. That's okay. And it was about an hour ago you visited, like you said. All right, good. Good to know. Okay. So, assessor, could you please confirm my patient's glucose level? Yeah, okay, normal. All right. So, I'm happy with that response too. Your glucose level is normal. Right. Are you in any discomfort at the moment? Are you in any pain at all? Oh, Oh, so sorry to hear that. All right, on a scale of 0 to 10, 0 being no pain, 10 being the worst pain possible, how would you rate your pain, Janet? Oh, so sorry to hear that. You will say 7. Oh, assessor, 7 is quite high. If it were to be real clinical setting, I would have loved to stop whatever I'm doing now and attend to Janet, because Janet seems to be in a serious pain now. But for the purpose of OSCE, could you please allow me to continue? All right, thank you very much. Can I assist you with repositioning? Oh, you are okay. All right. Can you still manage? I'm going to be checking through your match chart in a moment to see if you are due for analgesia. And if none, I'm going to be escalating your care. And as soon as analgesia is prescribed, I'm going to be coming back to administer that to you. Is that okay? Are you still happy for me to continue, please? All right. Thank you very much. And the last one is exposure, which is E. In the part exposed on your body, there is no bleeding. However, there is injury on your leg. I can see leg ulcer. So sorry to see this, Janet. And how are you coping with the ulcer on your leg? Oh, it's really been discomforting. I can imagine. So sorry to hear this. We're going to put measures into place to make sure you are fine again, right? And there will be proper treatment of the leg. If it will require to take a wound swab, we're going to do that to make sure everything is fine, all right? If need be, Janet, with your permission, would you be willing to be referred to tissue viability team for proper assessment of this wound and management? All right, thank you very much. I'm going to be documenting that, right? So thank you so much for your time. Regarding your past medical history, Janet, I could see you are diabetics, am I correct? As well as hypertensive, is that right? All right, and how well have you been complying with medications, if I may ask? Oh, very well. All right, good job. I'm happy to hear that. Right. So I just want to encourage you to still keep up with regular intake of your medication, because the more we take medications, the better for our health. Is that okay? Would you be willing to do that, Janet? All right. Thank you very much, Janet. I'll be stepping aside now, Janet, to document my findings, and I'll be back to relay the findings with you. Is that okay? Pending the time I will be away, if you need me for any reason, do make a shout and I will be here to attend to you. Is that okay? So, leaving my patients to document my findings, I'll go ahead and perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still okay? Right. The result of my findings shows you have a total new score of 0. It is nothing to worry about. It is absolutely okay, right? It does mean that the frequency of monitoring will be 12 hourly. Yeah. A few questions about your activities of daily living. How do you mobilize, if I may ask? Oh, you do that independently. Oh, good. That's good to hear. Right. How about your sleeping? Are you sleeping all right? Oh, good. You don't have difficulty sleeping. I'm happy to hear that. Right. Right. What about your feeding? Are you eating normally and drinking all right too? All right, good to hear. Talking about your psychosocial, Janet, I could read from your scenario that you are homeless and that is why you are living in the hotel. Is it okay to talk to social worker regarding this with your permission? All right, thank you. Say anything about your sexual life? Oh, you don't want to talk about that. I quite understand. That's fine. All right. That's okay. Right. Do you practice any religion? Or you don't and you don't want to? That's fine also. Right. Do you have any other question apart from this we have addressed? Oh, no question. Right. Oh, thank you so much. Yeah, I'm glad you've been helped. Okay. So I will be leaving you now. In case you have any concern at all, do ring your GP or 111 for non-emergency and 999 for emergency. Thank you very much for your time, Janet. I will see you soon. I'll go ahead now and dispose the non-reusable articles and clean the equipment that I've used in preparation for the next use. So I will go ahead now and perform my final hand hygiene following the 7 steps of WHO standard. Right, that brings us to the end of assessment using A to E approach. Now, let's move on to the planning. In this station, I'll be writing 2 care plan. Right, so I will write it very quickly now, and I will come back to read out those things I've written to us. Right, see you soon. If you ask me how was it, actually it was hot. Yeah, it was hot. So I came up with 2 nursing care plan. Yeah. The first care plan is, that is the nursing problem, is Janet is having an infected leg ulcer. That is wound. During our assessment with this patient, we found out that she was having an infected leg ulcer. Yeah. So what is your aim of care? My aim of care is to promote Janet's wound healing. Yeah, already the wound is infected, is to promote the wound healing. Right. The reevaluation date is today, the date of your exam, in bracket open and close. Every 24 hours, sooner if the clinical condition changes. Right. So your nursing intervention using Immatarid. Immatarid is your surest plug when it comes to writing nursing care plan in your OSCE. First letter, which is E, is explain and discuss all aspects of care to Janet and obtain consent, which is very important. Next to it is M, monitor and record Janet's vitals observations every 12 hourly and escalate as per News 2 policy. How do I get the 12 hourly? It is from the assessment. The patient was having a total News score of 0 and the frequency of monitoring will be 12 hourly. That is how we resorted to that. Moving on, next to M is A, that's AMA. A is assess Janet's wound for any sign of deterioration, such as increased pain, increased discharge, or foul-smelling odor. Very important. Mind you, this wound is already infected. You have to watch out for all of these signs, okay? Next in Immatarid is, after A is T. The T is teach. In any of your care plan, you need to teach this patient something. Yeah, that is important. You teach Janet importance of proper hygiene to prevent further wound deterioration. Already the wound is infected, so the proper hygiene will prevent further deterioration. Right. Teach Janet to include fruits in her diet and eat balanced diet to promote wound healing. For wound that is already infected, your goal is to promote wound healing. Everything you do for your patient, the rationale must be stated. Right. So having talked about the T, we move on to A, administration of medication. Administer prescribed medication, monitoring effectiveness and side effects after 30 minutes of administration. Very important. Next to it is R, is referral. In every of your care plan must be a team that you're going to refer the patient to for proper assessment and management. Refer Janet to tissue viability team for further assessment and management. Remember, we told Janet during assessment that if need be, with her consent, we should be willing to be referred to tissue viability team, and she gave her consent. Yeah. So next to R is I. You inform, because it's a community scenario. You could remember Janet was not wearing wristband. Yeah, so it does mean it's a community scenario. Janet was in hotel during assessment. Okay, so it's going to be treated as so as it is community, right? So you are, because there's no use of call bell, so it's going to be you will inform Janet to call her GP, 111 for non-emergency, and 999 in case of emergency. Right. Finally, on that note is D, document all care as planned. It's as simple as that. So we are done with the first care plan. Moving on to the second care plan now. The nursing problem is Janet is experiencing pain due to injury on the back of her leg with a pain score of 7 out of 10. Remember, during assessment, we assessed this patient and we saw ulcer on her leg. Yes, rating the pain that the patient was having, then the patient was in pain. The patient scored 7 out of 10. Right, that is what we are implementing here. It is not that we think about it or we formulated it by ourselves. It was gotten from assessment. My aim of care is Janet will verbalize relief of pain between 0 to 3 out of 10 following nursing interventions. Right, the reevaluation time date is today, the date of your exam in brackets open and close, every 30 minutes or as the clinical condition changes. Somebody will say, why 30 minutes when the frequency of monitoring is 12 hourly from assessment? Calm down. Right. When it is pain, is dealt with specially. Right. So pain is 30 minutes. Yeah, because within this period, you would have administered medication, and by 30 to 45 minutes, the effects should be seen. Yeah. So the reevaluation time date for pain is not based on your frequency of monitoring that you got from news. Rather, it is 30 minutes. Some school of thought will have it like 1 hourly. That's still not bad, right? So, using Imatarid now is still the way you wrote for the first one. However, you're going to change some things now that is peculiar to pain. Right, remember it was infected leg ulcer we did earlier, but here it is pain, so you treat it accordingly. However, some of those alphabets is still being represented the way that you wrote for the first nursing problem. Exactly. Right. So the E, you will still explain and discuss all aspects of care to Janet and obtain consent. Right. M, which is monitor, you monitor Janet vital observation every 12 hourly and escalate as per News 2 policy. Still the same as what you did earlier. Assess now, that is where the difference comes. Right, you assess Janet's pain using pain assessment tool. A quick one for any scenario at all that requires you to use special tool. Please, when you are writing your care plan, make sure you reference such tool. It is very important. In this case, I assessed the patient's pain level. The tool I used is pain assessment tool. So I must reference that here. I must capture that in my care plan. Right. So moving on. Teach. Teach Janet diversional therapy such as watching TV, reading novels, or deep breathing techniques. All of this will channel the patient's mind away from the pain she is feeling and focus on something else. In turn, it is believed to relieve the patient of the pain to a certain reasonable extent. Right. That is administer, just like you did in the first nursing problem. Right. You administer prescribed medications, you monitor effectiveness and side effects every 30 minutes. Right. Next to that is referral. Refer Janet to pain assessment team for further plan of care. The next one is inform. Inform Janet to call her GP, 111 for non-emergency and 999 for emergency. Lastly, on that note, is document. Document all aspects of care as planned. That is it. Mind you, as soon as you've been given paper to write on for your planning, go straight to the base of the document and fill in your details. Because failure to fill in these details, no matter how beautifully well you might have written, is still going to be a fail, because it will be tantamount to you have not done anything on that document if your signature is not appended. Right. I've got a bonus care plan regarding that. It is not in all cases that the ulcer may be infected. It may just be a kind of mild, might not be a serious injury. Right, might just be bruises. Of course, if the patient's wound is not infected, you cannot formulate anything in OSCE. You act based on what scenario is painted or what you can see. So if your scenario does not state the patient is having infected wound, don't make anything up. Very important, right? Bruises that is not properly taken care of can result to something big. Yeah, it might result to the wound getting infection and all of that. So in that case, you are going to write that the patient is at risk of infection. Right, let me quickly take you through that. Just write for the nursing problem, say Janet is at risk of infection due to the injury on her leg, period. Right, so your aim of care is for Janet not to manifest any sign of infection. That is your aim of care. Right, your reevaluation date will be today, your exam day in bracket open and close. This is essential. Right, every 24 hours, sooner if the clinical condition changes. Right, it's still a matter read you are going to use. Explain and discuss all aspects of care to Janet and obtain consent. Monitor Janet's vital observation every 12 hourly, or as the case may be in your exam. I am using 12 hourly because this is what I got from my assessment. Escalate as per News 2 policy. Right. Assess Janet's wound for any sign of infection, such as pain, discharge, smelling, or redness, similar to what we did when the wound was infected. But here, at risk of infection, it has not happened. So you need to watch out for some signs for this not to happen. Is that okay? All right. Next is teach. You have to teach Janet importance of proper hygiene to prevent wound infection. Mind you, you must state the rationale behind every of your action. Right. Next to that is, you are going to change Janet's dressing using ANTT to prevent infection. Abbreviation or acronym is not usually acceptable when you're writing care plan in OSCE. However, there are some universal acronym. One of it is ANTT. If you write capital letter ANTT in your exam, it will not still be a fail. It's universally acceptable. ANTT is not going to be penalized. Is that okay? Next to that is administration of prescribed medication. Administer prescribed medication, monitor effectiveness and side effects after 30 minutes. Right. Next to that is referral. Refer Janet to infection prevention and control team for further plan of care. Next to that is, you will inform Janet to call her GP, 111 for non-emergency and 999 for emergency. Right. Lastly, on that note, document all aspects of care as planned. That is that about care plan. You have successfully written 3 care plans in no time. Yeah, any of these 3 care plans is a very good one to write in case of this homeless patient if it's coming for you as your scenario in your exam. Right, let us move on to implementation station. To approach my scene, I see my scene is safe, nothing to harm me or my patient. I provide privacy by pulling the nearby curtain. I go ahead to perform my hand hygiene, following the 7 steps of WHO standard. Ample amount of gel to my palm. I rub palm to palm, right palm over left bosom, vice versa. Fingers interlaced, fingers interlocked, vice versa. Rotational rubbing of the thumb, vice versa. Rotational rubbing of the finger close to my palm, vice versa. Rotational rubbing of my wrist, vice versa. My hands are clean and I will allow to air dry for 30 seconds as I approach my patient. Hello, I'm Kenny, one of the nurses that will be attending to you today. How are you? Right. The reason why I'm here is to administer your due medication for 1400 hour. Is it a convenient time, please? All right. Before we proceed, could you please confirm your full name, date of birth, and your first line of address while I double check with my paperwork, please? All right, Janet James, 01/01/1992 is your date of birth. Your first line of address, 27 Dalton Grove, Badley Green. All right, are you allergic to anything at all, please? Okay, it is properly documented here that you are allergic to penicillin. And what reaction do you get if you take that? Oh, rash. It is properly documented in my notes. All right, so I want to assure you that we will not give you anything containing penicillin. Is that okay? All right. How may I address you, please? Okay, Janet. So, assessor, I can confirm I am with the right patient and I'm happy to proceed. All right. Is it okay to take you through your medication record chart, please? All right. I have the community mark chart for Janet James. The date of birth 01/01/1992. The NHS number is 1234567. The address is 27 Dalton Grove, Badley Green. Height is 1.65 meter. The weight is 72 kilogram. Body mass index is not stated. The GP name is Dr. Tolu. The surgery address is Badley Green Surgery. Under the details of the prescriber, the name of the prescriber is Dr. Tolu. The GMC number is 1234567. The signature is properly appended as well as the contact details. Moving on to the details of person administering the medication, I will come back after I might have administered the medication. Moving on to alert and allergy. The medicine the patient is allergic to is penicillin and the effect is rash. It's properly documented. Moving on to medication risk factor. There is no risk factor ticked for Janet. I'm happy to move on. Moving on to the next page, I still have community mark chart for Janet James. The date of birth 01/01/1992. Of information on this chart is as the same as previous. Here, I have medication coding. I've read and understood them. If the need be, I will come back to it and use appropriately. Moving on to community patient specific direction. The date is today. The drug is flucloxacillin. The dose is 500 milligram. The route is per oral. The time is 1400 hour. The frequency is 4 times daily. End date is +6 days. Prescriber name and date is properly documented. It is a valid and legible prescription. However, I will not be administering this medication because Janet is allergic to penicillin. Flucloxacillin belongs to this group. So I'm going to be coding the medication a code of 10 and I will append my signature, date and time. I will go back to the omitted part, that where there is omitted dose of medicine and delayed doses. I'm going to document everything. So I'm going to code the medication 10. I will append my signature, date and time. That is what is written under that part, right? So if I had given, I would have appended this, my signature, date and time. But now that I didn't give, I will still go ahead and code it, append my signature, date and time because it is a community scenario. And I will go ahead to the back under omitted dose of medicine. That is the last part of the medicine chart, right? Even if it is hospital scenario, it's still the last page. So the date is today. The time is 1400 hour, which is my time. The drug is flucloxacillin. The dose is 500 milligram. The route is per hora. The instruction is for infection, like for wound infection, right? The reason for omission is allergy. Patient is allergic to penicillin. I will sign, and that is that. I will go back to the next medication. Still under community patient specific direction. The date is today. The drug is sertraline. The dose is 50 milligram. The route is per hora. The time is 1200 hour. The frequency is once daily. The end date is not stated. The prescriber name and date is properly documented. It is a valid and legible prescription. However, it is not due at my time and it has been previously given by a colleague, which is properly documented. I'm happy to proceed. Still under community patient specific direction. The date is today. The drug is paracetamol. The dose is 1 gram. The route is per hora. The time is 1400 hour. The frequency is 4 to 6 hourly. The end date is not stated. The prescriber name and date is properly documented. It is due at my time. It is a valid and legible prescription. All right, Janet, are you still in any form of pain, please? All right, on the scale of 0 to 10, 0 being no pain and 10 being the highest pain possible, how would you rate your pain, please? Oh, you will say 7. Oh, so sorry to hear this. Right, right. So I can confirm that your weight is above 50 kilogram. So I'm happy to administer the medication. And I've checked previously in the prescription, you have not taken paracetamol in the last 4 to 6 hours. Right, so I'm happy to proceed. I will not be signing this medication now until after the administration is completed. Right, but I will be administering this. Moving on, still under community patient specific direction. The date is today. The drug is chlorpheniramine. The dose is 4 milligram. The route is per hora. The time is 1400 hour, which is my time. The frequency is once daily. The end date is +5 days. Prescriber name and date is properly documented. It is a valid and legible prescription. I will be administering this medication. Flipping to the next page, I still have community mar chart for Janet James. The date of birth is 01/01/1992. The rest of information on this page is as the same as previous. There is no other medications prescribed for Janet. Right. So I'm happy to go and dispense the medications now. I have on my hand chlorpheniramine. It is not expired. The expiration date is February 2026. So I'm going to be dispensing 1 tablet. All right. So I'll go ahead and compare that with the prescription to be sure it's the same medication that is prescribed. So I have on my hand chlorpheniramine, and checking against the prescription is the same chlorpheniramine that is prescribed. The stock dose is 4 milligram and the prescription is 4 milligram. So I am happy to dispense. In an aseptic manner, I'm going to open the lid of the medication. I will dispense carefully the medication to the lid, making sure my hand does not contact it. And I will pick the medicine pot and I will drop it carefully into the medicine pot, right, in an aseptic manner. So it is from the medicine bottle to the lid and from lid to the pot, right. I have on my hand paracetamol. It is not expired. The expiration date is February 2026. I will go ahead and compare that with the prescription to be sure it's the same medication. Right, I have on my hand paracetamol. 500 milligram is the stock dose. Comparing that with my prescription, is the same medication that is prescribed. However, it is 1 gram. That means I'm going to be dispensing 2 tablets of the paracetamol. Right. Prior to every drug administration, the 6 rights of medication principle need to be ensured. That is, I have the right patient, the right medication, the right dose, the right route, the right prescription, the right time and date, and I'll be documenting appropriately after the administration. I have all the 6 rights in place and I'm happy to proceed. So I will go ahead now and dispense 2 tablets of paracetamol in an aseptic manner from the container to the lid and from lid to the pot in an aseptic manner, making sure my hand does not contact it. Right. So I'll go ahead and close the lid. Going back to my patient, I need to perform my hand hygiene according to WHO standard. All right, Janet, I'm back. Are you still happy for us to continue? Thank you. So before we continue, could you please reconfirm your full name, date of birth, while I double check with my paperwork, please? All right, I still have Janet James. Your date of birth 01/01/1992. Good. Your NHS number is 1234567 and your first line of address 27 Dotton Grove, Badley Green. Yes. You said the other time that you are allergic to penicillin. Am I correct? And the reaction you get from that is rash. Yes, it's properly documented in my note. Assessor, I can still confirm I am with the right patient and I'm happy to proceed. All right, Janet, could you please confirm with me if you have any difficulty swallowing? All right, you have none. I'm glad to hear that. And are you having any nausea at the moment? Oh, good. That's good. Right. Do you want to take your medication together or you want it separately? Oh, you want it together. Right. Okay. Do you want to take it with squash or water, please? Oh, water is okay. Oh, do you want to take the medication first or water first? Okay, water first. Here you go. Right. And here is your medication. Right. Could you please confirm you have swallowed the medication by opening your mouth, please? Oh, great. Oh, good. So, assessor, I can confirm Janet has safely taken her medication. Right. All right, Janet. Okay, so I'll be stepping aside now to quickly document what I've given you and I will be back. Is that okay? Right. Leaving my patient, I'm going to perform my hand hygiene following the 7 steps of WHO standard. All right, Janet, I'm back. Are you still comfortable? Right. So I will still be with you for about 30 minutes. And after I might have left, if you have any concern, do not hesitate to contact your GP. 111 for non-emergency and 999 for emergency. Is that okay? Right. So I'm going to clean the used equipment now in preparation for the next use, and I will go ahead and perform my final hand hygiene following the 7 steps of WHO standard. Right, that brings us to the end of implementation. That is the administration of medication station. I will see you shortly in evaluation station. That is the handover. So in this station, contrary to the popular opinion, you are not to jot anything. It is an 8-minute station. It's a talking station. Whatever you have written will not be addressed. So there is no point wasting your time, because the bulk of the thing you're going to talk about is in your assessment. Yeah, and you've got other documents. You're going to read through all of those documents. You will have all the documents you have used in your assessment and your planning. The documents you use during your assessment and planning will be handed over to you because it is part of this station. So there is no point jotting anything again, because that 8 minutes will just be like 6 minutes or less in the exam. You don't want to take such chances, right? So here we are just going to talk, right? There is nothing to jot down. Hello, I'm Kenny. I am a community nurse. The reason why I'm here is to hand over my patient. Her name is Janet James. The date of birth is 01/01/1992. The address is 27 Dalton Grove, Padley Green. The reason for the handover is Janet's condition has recently worsened and she needs further plan of care. That's about situation. And for the background, where the bulk of the work is, you will get most of this information from your assessment scenario. Janet is a known homeless patient who is having ulcer on her leg. She's been attended to. She lives in 27 Dalton Grove, Badley. Regarding Janet's past medical history, she's a known diabetic as well as hypertensive patient since 2017, for which she takes amlodipine and metformin respectively on daily basis. Also, the ulcer on her leg has been in place for some years, for which she goes to clinic to receive treatment. She's currently taking antibiotic for that. Janet does not smoke nor drink. She's allergic to penicillin and its derivatives. The reaction she gets from that is rash. Upon Janet's initial assessment, a total new score of 0 was gotten, and the frequency of monitoring will be 12 hourly. During the initial vitals with the current one, Janet's condition has recently worsened from news of 0 previously upon initial assessment. Now Janet is scoring 2. Comparing Janet's initial assessment with the most recent one, Janet's condition has recently worsened. She's now having the total new score of 2 compared with the former assessment where she was scoring 0. She's having the score in her temperature now. Every other parameters are okay except for temperature, where she's having 39.1, and that give her a score of 2. So when Janet was with us, 2 nursing problems were identified. The first one was Janet was having an infected wound, and the aim of care is to promote Janet's wound healing. My interventions for Janet were: Janet was monitored 12 hourly according to the new score that was gotten, and it was escalated based on the NILS 2 policy. Janet's wound was assessed for further signs of deterioration, such as foul smelling, excessive discharge, or excessive pain. Janet was taught the importance of proper hygiene. She was equally educated to include fruits and protein in her diet to promote wound healing. When Janet was with us, she was referred to tissue viability team for proper package of care. The second nursing problem that was identified, Janet was experiencing pain with a pain score of 7 out of 10 due to the leg ulcer she was having. The aim of care was for Janet to verbalize relief of pain between 0 to 3 out of 10 nursing interventions. Janet's vital observations were monitored and recorded according to News 2 policy every 12 hourly. Janet's level of pain was assessed using pain assessment tool. Janet was taught diversional therapy such as reading novels, watching TV, and deep breathing exercises to take her mind off the pain. Janet was referred to pain assessment team for proper package of care. The due medications were properly administered, watching out for effectiveness as well as side effects after 30 minutes of administration. All care were documented as planned for Janet. Finally, on that note is my recommendation, which include should be monitored every 4 to 6 hourly according to the most recent observation. Still assess Janet's level of pain using pain assessment tool. Also, still keep watching for any signs of deterioration such as increased discharge, increase in level of pain, or any foul smelling odor. Also, reminders should be sent to those teams initially mentioned for follow-up. Still teach Janet on proper hygiene as well as the deep breathing exercises, also diversional therapy such as watching TV or reading novels. That will be all from my end. Do you have any question for me, please? All right, thank you very much. Should you need any other enquiry, do not hesitate to contact us. Thank you. All right, colleague, that brings us to the end of APIE using an homeless patient as a case study. I hope you've learned something in this video. Please do share, like, comment. Let me know in the comment section if there is any area or any video you would want me to make, and I will try as much as I can to bring that to you. Until I come your way in my subsequent videos, keep practicing OSCE. You've got this. You're already a success. Bye.